So this lecture is designed to help you connect what you've been learning in the ethics course with what you'll be expected to demonstrate on the BCBA exam. Here are the objectives for this lecture. Here are the key concepts for this lecture. You may want to download the task list if you don't have it already, as we'll be referencing it throughout this lecture. So here's what you need to know. The BCBA exam contains items from the task list from the Behavior Analytics Skills section and the Client-Centered Responsibilities. The Foundation section is going to be embedded throughout the other sections, as is the Professional and Ethical Compliance codes. So they're not going to ask you to rattle off code 2.01, but they may ask you to apply that code to a scenario or a question. The most important thing is that you be able to understand ethical conduct as it relates to professional practice in accordance with the professional and ethical compliance codes. For example, you may be asked to apply ethical considerations related to assessment in deciding whether you should use an FA or an FBA for problem behavior. The BACB 4th edition task list is made up of 3 sections: the basic behavior analytics skills, client-centered responsibilities, and foundational knowledge. So now let's talk about how this course has been preparing you for what you're going to be expected to do on the BCBA exam. So course components consisted of the objectives, the content knowledge, activities, allowing you to make connections between instructional material, allowing multiple opportunities for you to review and practice the material, and give you opportunity to research and debate issues in the ethical debates. So some of the specific materials we utilized to do this were the syllabus and the student guide to give you the objectives and what you should learn, the textbooks and the articles to give you the history and the ethical principles, as well as give you opportunity to view multiple perspectives. And then the instructional presentations, assignments, and scenarios were designed to let you apply the codes. In other words, to get you to think like a behavior analyst. Here's some other ways that assignments in the course allowed you to get ready for the exam, because you had to develop defensible arguments, evaluate research in the debate. So all practicing behavior analysts need to be able to demonstrate the task list items. But you also need to ask yourself what issues are associated with these tasks. What fundamental knowledge regarding the practice of ABA should guide my decision? And what core principles and professional and ethical compliance codes apply? So the measurement section of the task list relates to records and data and explaining assessment results in the compliance codes. Results. Here's just, if you look at it lined up next to each other. So for experimental design, professional and ethical compliance codes that line up are behavior analytic assessment, conceptual consistency, and individual behavior change programs. So again, here it is lined up next to each other. So behavior change considerations in the compliance codes, you have considerations regarding punishment, and here they are lined up next to one another. So when you consider fundamental elements of behavior change task list, the compliance codes that relate are those related to least restrictive procedures, avoiding harmful reinforcers, and discontinuing behavior change programs. And so that directly lines up with the codes. These codes directly line up with Section D, the fundamental elements of behavior change. So when you consider behavior change systems, the codes that relate are reliance on scientific knowledge, boundaries of competence, and also maintaining competence through professional development. And then in this section, specific behavior change procedures, here's some of the task list items that line up with those codes. Next, you have client-centered responsibilities, medical consultation, behavior analytic assessment, and then here's the task list items lined up with that. Next, you have measurement in the compliance codes, So client's treatment and intervention efficacy. And you can see how that lines up with the measurement section of the code. You have assessment in the compliance code. And again, here's how it lines up directly. Then you have interventions in the compliance code. And here's how it can align. Next, you have implementation, management, and supervision in the compliance code. And here's how it can align. Approving behavior change programs, describing behavior change objectives. Lastly, you have foundational knowledge. And these are the codes that relate to the foundational knowledge section of the task list. So most importantly, putting it all together, preparation for the BCBA exam requires you to understand and apply the professional and ethical compliance codes based on the task list. You have to be able to identify and prioritize issues associated with potential ethical dilemmas to make decisions that are conceptually consistent with the principles and basic concepts of ABA and the compliance codes. To develop and maintain an ethical practice as a behavior analyst, you have to follow the compliance codes, evaluate the literature to select treatments and interventions that are conceptually consistent, consider situations from multiple perspectives. Remember, in some situations, in most situations, you're going to consider the client's needs first, unless they're being a danger to others. Most importantly, as a behavior analyst, to be ethical, you want to humble yourself in order to benefit others. You want to make sure that you're considering multiple perspectives so that you're getting the best possible treatment for your clients. Here are references that we used in putting this PowerPoint together.